I would get these nightmares almost where I would react to some sort of threat. It could be somebody pointing a gun at me, and I had one of these dreams. And I launched myself out of the bed and landed headfirst on the floor. And it was at that stage when I decided I needed medical help.
Within the brain circuits, there's a mechanism that stops you acting out your dream. And in patients who have this disorder of sleep called RBD, or REM sleep behaviour disorder, that switch is broken.
So we know that in RBD, over time, people have a risk of going on to develop Parkinson's. People are admitted into hospital and then have to try and sleep in an unfamiliar environment with lots of wires, paste and superglue attached to them. So the sleep that they get in that environment is often not representative of their normal sleep. We're trying to explore the use of wearable sleep equipment to help to diagnose and even screen people for REM sleep behaviour disorder, and to automatically analyse the data that's collected.
We no longer have a 12-month waiting list to access a sleep study. The costs are significantly reduced. The analysis time are also reduced because it's all automated using MLA approaches. But also we have a more representative recording of that individual's sleep. And we have multiple nights in their own home.
It might even allow us to measure changes in sleep over time in response to the treatment. Will someone who perhaps is going to go on to develop Parkinson's have big changes in their sleep? And if so, what? Compared to perhaps people who aren't going to go on to develop Parkinson's.
People really have to suffer from it. You know, they're literally like this, bent over like this, they can hardly speak. And if there's anything that what I'm doing contributes towards their treatment or preventing them getting that far, would be good.